the Queen on the balcony and having all those people out there to welcome her. She should have rightly felt, very proud about that moment. And I think that just in the way the whole country feels proud about our Queen and how she served us in such an amazing way for 70 years.
How did you feel about the Prime Minister being booed?
Well, look, I saw the clips of that afterwards. There were boos, there were cheers, but look, no politician is universally loved. It won't be the first time a politician is booed, and there'll be much of that for many politicians down the line. I think that people are perfectly entitled to their views, but what's more important is to have a Prime Minister that's getting on with the job, that's delivering for the country, and that's exactly what we have.
54 letters needed to trigger a confidence vote in him. Are you expecting that threshold to be reached?
Look, I don't know. That's the honest answer. No one knows at this point, apart from Sir Graham Brady, my colleague, who is the chair of what's called the 1922 committee. We know that a number of colleagues are already gone public with asking for such a vote. That's a decision, of course, for them. If 54 letters are reached, I'm sure a vote will be called. I do think it's possible, but I don't know.
I was reading in The Guardian this morning a senior MP saying about the mood of the constituents, because, of course, a lot of MPs have been out and about in their constituencies given the 4-day bank holiday weekend for the Platinum Jubilee, saying, I'm getting people coming up to me and greeting me with that smile and that tilt of the head that's usually reserved when your Labrador puppy has just been run over. Goodness.
Look, I think this country doesn't need a vote of confidence in the Prime Minister. I think what we need to be doing as a country is certainly looking ahead to the challenges that exist. I'm here today at Kingston Hospital, standing behind this brand new scanner, by the way.
I want to talk to you about that in just a second, but I just want to deal with Partygate, and then I'm going to come back to that, if I may. I'll give you plenty of time to talk about while you're in Kingston. But while we're still talking about the popularity of the Prime Minister, there was a weekend poll which was released ahead of the Wakefield by-election, and that's just in a couple of weeks' time, isn't it? I don't know if you've seen it, but it makes very, very, very unhappy reading for the Prime Minister this morning.
Look, I saw that poll, and there were particular circumstances of the resignation of the former MP in Wakefield, and frankly, I'm not surprised by what I saw and what I read some of the detail around that poll. But the only poll that's going to matter is the one on the 23rd of June, both for Wakefield and also Tiverton and Horrington. I was in Tiverton and Horrington on Saturday with Helen Herford, our fantastic candidate there, and certainly on the doors that I knocked on, there was lots of support, especially because they were chatting to me as the health secretary around our vaccination program, which has been world-leading, the record investment that we're making in the NHS, the record increases in the NHS workforce, the adult social care plans came up and how we're tackling those. For the first time, we have a Prime Minister who's willing to tackle that. So, let's see what happens on the 23rd of June.
To fight elections, you need money. Lord Michael Tory has said he'll refuse to make further donations unless Boris Johnson is removed from office.
Look, he's entitled to his view, and every political party has its donors, and I am confident. I speak to donors or potential donors to the Conservative Party many times, and I know that many of them are fully behind the Prime Minister and our programme for delivery. That's what motivates them. What people look at, whether they're donors or ordinary people, what they look at is delivery. I'm standing here right now, as I say, in this hospital that's getting record investment. Our economy as well. We have the lowest unemployment rate in almost 50 years. And of course, we've got challenges, especially cost of living challenges, the COVID backlogs. But this is a government that's getting on with the job. And that's what I think people expect politicians to focus on.
A memo circulating over the weekend calling the Prime Minister the Conservative Corbyn. What do you make of that?
Well, this Prime Minister is the one that saved the country from Corbynism. You know, if you look back at that 2019 election, there was a very real prospect that Labour under Jeremy Corbyn could have won. Instead, this Prime Minister delivered the biggest majority that the Conservatives have seen since Margaret Thatcher's time, and used that majority to deliver for this country. You're delivering on Brexit, getting on with dealing with the pandemic. Look, did we get every decision right? The Prime Minister has been very honest about this, especially when it came to the pandemic. We didn't get every decision right. No leader in the world was able to deal with the global pandemic and get every decision right, but we got the big decisions right. And now in the aftermath of this pandemic, again, as the Health and Social Care Secretary, I'm very focused on both of those. You're getting our health system back up and running, back to normal, dealing with those backlogs, but also on adult social care, delivering with a reform plan for the first time, putting in extra billions, but also leading to better integration between health and social care. That's what people want us, that's just the kind of thing they want us to focus on.
Yeah, but if he's so fabulous, this Prime Minister, why is he about to face a vote of no confidence?
Look, as I say, whether there's a vote of confidence or not, that's a decision for my colleagues. And no Prime Minister, no leader of the Conservative Party, as far as I'm aware of, has enjoyed 100% support of colleagues. We're a democratic party. We're actually the most successful democratic party in the Western world, and part of that strength comes from having differences of opinion at sometimes, and we have processes. So if this threshold of 54 letters is reached, there will be a confidence vote, and in that case, of course, there should be. There may well be one. If there is, the Prime Minister will fight and stand his corner with a very, very strong case. So let's just wait and see what happens.
Tell me about the scanner.
Well, this is, as I said, this is Kingston Hospital I'm at today. This is a brand new CT scanner. I think the third one in this particular hospital is part of our plan to invest billions in dealing with those COVID backlogs. We've opened up, since the pandemic, some 90 what we call the community diagnostic centres. These are the new one-stop shops for scans and tests and checkups in the most convenient of locations. We're going to have 160 of these in total over the next couple of years, and together they will deliver some 9 million more tests and scans and checkups, freeing up NHS capacity. This is just one example of how we're trying to deal with the backlog. But also with the backlog itself, we're making some good progress, I think it's fair to say, on dealing with waiting times. Those waiting the longest, that number has been halved in the last 4 months, thanks to the plans that we've got, but thanks most of all to the efforts of all the staff that are working across the NHS. And I want to take this opportunity to thank them again for everything that they are doing, working day in, day out to deliver for patients across England.
The Royal College of Nursing says that on their last shift, 80% of nurses say that staffing levels were not sufficient to meet the needs of patients.
We do need more nurses, and that is why we set out a plan at that last election of 50,000 more nurses. We've got 30,000 already just in the last year, despite the pandemic and the challenges. I think in the last year we've added 2,400 more nurses, and by the way, we've also added over 4,000 doctors. So we are increasing the NHS workforce. It is challenging. We need more doctors and nurses, and we are recruiting at the highest levels ever. We've got more people working in the NHS than ever before, and we've got more nurses in training, doctors in training than ever before. We're pulling every lever to get the workforce that we need.
OK. What was your favourite moment of the Jubilee celebrations? If you don't say the Queen on the balcony, Paddington Bear or Prince Louis, then you're never coming back.
My favourite moment actually was Paddington Bear.
There you go.
I couldn't believe it, and nor could my kids. I couldn't believe it, but it just sort of goes to show you that just how amazing our Queen is, that she was able to surprise us, including, as I understand it, her own family with that what I thought was just a magical moment that will live with us forever.
Yeah, we're out of time, but we just want to show this to our viewers, which you shared on your Instagram feed. This was you at the Silver Jubilee in 1977, like it was yesterday, eh?
Yeah, I love that picture. I was in two minds whether I should tweet it out or not. I showed it to my wife, and she said, "Look, get it out there. You haven't changed." And I think many of us will probably have moments like that, especially if you were lucky to be alive in 1977 and see the Silver Jubilee as well. And to think now, you know, so many years on, our Queen is still there and has achieved so much more.